Good day, everyone. Good to get together. I'm Dr. John Ward, Director of the Coalition for Global Hepatitis Elimination and Task Force for Global Health. You'll soon be hearing from my colleague, Lindsay Hebert. And we're here today to talk about requests for proposals that we have posted on our website with the financial and technical assistance of the US CDC to provide support to civil society organizations to promote hepatitis B birth dose vaccination in their communities. What I'd like to do is give you a little bit of information about why this is important, particularly in countries of Africa, and some of the examples of some of the work that the coalition has done over the last several years to promote the adoption and scale up of hepatitis B birth dose vaccination. And then I'll turn it over to Lindsay to go over the aspects of the request for proposals. It's important to always take great pride in recognizing that we have in our hands the first cancer preventing vaccine, hepatitis B vaccine, first licensed in the early 1980s, first really begun to be promoted for infant immunization later in that decade, and then recognizing the importance of vaccination and moving that on for newborns to receive it. Hopefully most of you know the vaccine is it's recommended to be given at the time of birth, preferably within 24 hours, and then the completion of a 3 or 4 dose series through the infant immunization schedule. The infant immunization schedule is a combination vaccine, and as a result, the coverage of that has grown to approach the 90% coverage rates that are the targets for WHO elimination strategy. And as a result, there's a growing proportion of new infections among infants that is the result of mother-to-child transmission, increasing the importance of hepatitis B birth dose vaccination. Coupled with that is the high risk of chronic infection for newborns who do become infected, where 90% of them will remain infected and with a 1 in 4 chance of dying prematurely of hepatitis B related liver failure and liver cancer. As I mentioned, starting in 2009, WHO recommended vaccination
progress,
preferably within the first 4 hours of life. I was a member of the technical advisory group to WHO at that time that made their recommendation that was adopted and has been in place since that time. The hepatitis B vaccine at birth is very effective in preventing mother-to-child transmission, with the greatest risk of breakthrough infections among vaccinated infants if they're born to mothers with high viral loads. Because of that, it increases the importance of maternal screening to identify mothers who are hepatitis B surface antigen positive, to ensure that they have timely vaccination of their newborns, and then to follow that with a viral load test to identify those with high viral loads so that antiviral prophylaxis can be given to those mothers, decreasing their viral load and preventing those breakthrough infections. And this is one of the reasons that hepatitis B has been added to HIV and syphilis as a triple screening for pregnant women, so that the right prevention interventions can be put in place to interrupt transmission of all 3 of those pathogens. So we look at what we're trying to do with the importance of the 3-dose vaccination series for infants, a timely birth dose to reduce mother-to-child transmission, hepatitis B surface antigen testing of pregnant women, to again assure timely vaccination of their newborns, and then to make a decision regarding additional measures in place to further make that protection 100% to achieve true elimination of mother-to-child transmission. With the scale up of hepatitis B vaccination among infants around the world, there's been a tremendous public health impact. Last year, it was estimated that over 22 million deaths have been averted because of infant, including newborn vaccination with hepatitis B vaccine, exceeded only by measles in its public health impact. And that's what we're trying to continue to advance with this initiative that we'll be speaking about today. That large public health impact is because of this scale-up of vaccination. There's a United Nations and WHO goal of reducing hepatitis B surface antigen prevalence to less than 1% among children less than 5 by 2020 and to 0.1% by 2030. Now, the good news is that the world achieved that United Nations goal of 1% of decreasing prevalence to less than 1%, 0.93%. Really, the only United Nations goal targeting 2020 that was achieved was this protection of infants from hepatitis B. Now, regrettably, the only region that did not reach that target in the WHO system was the Afro region because of low vaccination coverage, particularly for hepatitis B birth dose vaccination, where it's estimated that only 17% of children were receiving timely hepatitis B birth dose vaccination. So one of our challenges is that relatively few countries in the African region have adopted a policy for hepatitis B birth dose vaccination. There's been some increased movement in that direction that we'll probably touch on later in our webinar. Next slide, please. And when you estimate the potential impact of scaling up hepatitis B birth dose vaccination in Africa to reach the target goal set by WHO, it's estimated that we can avert 500,000 deaths among infants born this decade in Africa. So a huge public health impact that we have an opportunity to work together to realize, beginning with this initiative that we'll be talking about today. Thank you. For our part, in collaboration with the US CDC and the WHO regional office in Africa, we've done a variety of activities to support the launch and scale up of hepatitis B birth dose vaccination. We developed what we call a community practice where vaccinators of newborns and immunization program managers can come together, share lessons learned, what appears to be working well in their country and what are their challenges, to see how we can build an environment of collaboration. And we continue to look for those types of opportunities. We also developed a toolkit to help the what's called the National Immunization Technical Advisory Groups, or NITAGs, that advise ministries of health on immunization policies. This toolkit provides in-depth information about the epidemiology of hepatitis B, the safety and effectiveness of hepatitis B birth dose vaccination, and some of the examples of program outcomes in Africa. Also, recognizing the importance of Gavi funding, we did a survey earlier this year. In 2018, the Gavi Executive Board approved support for the introduction of hepatitis B birth dose vaccination in Gavi eligible countries, but that support was put on hold because of the response to the COVID pandemic. And it was really unknown if that executive board would lift that pause when they met again this past June. So we did a survey of program managers in Africa to show that the resources needed to continue COVID vaccine was not an issue for those countries in their consideration of introducing hepatitis B birth dose vaccination. Rather, the availability of Gavi support was the highest priority in determining their move toward introducing hepatitis B birth dose vaccination. And we published this in March and April, and I believe that in part it promoted the executive board of Gavi lifting the pause and approving the support from Gavi to begin in the next year or two. The coordination team to help Gavi develop the requirements, what aspects of vaccination supply, distribution, delivery will be supported. That team formed in September and had their first kickoff meeting this week with a look to a funding announcement expected next year that countries can apply to obtain resources. And I look at some of the needs for support that was communicated to us via this persons responding to the survey. If you notice that the third bullet there, increasing political and civil society awareness of hepatitis B and health benefits of vaccination, was one of the leading needs cited by these countries. And that's why I say this here, because I think it really emphasizes the importance of our work together that this webinar represents a kickoff of. Over the last year or two, we have, again, with the assistance of US CDC, we did support a variety of civil society organizations in their health promotions of hepatitis B birth dose vaccination. And those examples of that work are all up on our website at globalhep.org. I'll turn it over to Lindsay to give us some examples and then go into details about this funding opportunity. Lindsay?
Sure, and thank you all for joining. Just the next few slides highlight some of the work of the previous recipients. If they're on the call, we thank them for joining and for their great efforts over the past couple of years to promote birth dose in their countries. So the first examples, which as John mentioned, are all available on globalhep.org, is from the Hepatitis Aid Organization in Uganda. They worked on a number of IEC materials, jingles, posters, audiovisual materials, radio spots. They worked using radio, TV, newspapers, social media, health centers, targeted meetings. One of the radio spots is called Freed the Next Generation, and it was so great we turned it into a music video, which is available on YouTube, and it focuses on hepatitis B birth dose and protecting young children. Here are just a few examples of the targeted trainings and meetings they held with different stakeholders. And we'll be sharing these slides, but just to give you a sense of their reach, they did a great job evaluating their impact in terms of quantifying the number of people that were able to hear their radio spots, how many people were able to see their different visuals, and thinking through what that means in terms of influencing their community and their policymakers. So for the next example, we have Hepatitis Alliance of Ghana, and their project goals were threefold: political will, increasing healthcare provider knowledge, and increasing general awareness among the public of prevention of mother-to-child transmission. And here are examples of some of their products they developed. On the left was shared at colleges and with providers. And on the right is a video made in Twi, the local language, on protecting newborns. And again, is available on YouTube if you're interested. Here is just a summary of their training of midwives that they worked on. They held a number of events in collaboration with different midwife societies around the country. They also developed a program to train champions who would be the local go-to person for advocating for birth dose in their setting, and that program was quite successful. Just a few more examples, one from Uganda as well, the Great Lakes Peace Center. Here's an infographic they developed with the Ministry of Health on hepatitis B birth dose being a key vaccine. From Malawi, a different type of flyer developed. And just to emphasize, all these resources and examples are available on their website. Thanks again for the organizations for all their hard work, and hopefully these examples show that we encourage creativity and tailoring the objectives to your local setting and interpreting on what's going to be most effective for your policymakers, for your community, and what resources you have available. And we were really amazed at the diversity and the creativity of the products developed last year. So moving toward this year's request for proposals. The objective is really to increase awareness on the importance of birth dose vaccination among different audiences, among pregnant persons themselves, their families, healthcare workers and providers, and also policymakers where there's an absence of birth dose currently. To be eligible for this request for proposal, you must be a civil society organization based in Africa. Your main point of contact should be within the country that you're proposing to work in. And there will be a preference, additional weight given to CSOs with experience in previous health promotion campaigns related to infant immunization, hepatitis B immunization, if available, and also maternal child health. So there's two categories of funding this year. One category for countries that have already adopted hepatitis B birth dose, and another category for countries that have not yet adopted hepatitis B birth dose. So in the PDF available online, you've likely seen this chart where we've tried to summarize the countries that have already adopted hepatitis B birth dose. And the countries on the top part of this table are those that have adopted birth dose in previous years, but have not achieved high coverage, which we've defined as 75%. And then countries in the lower part of the table here are countries that we're aware of recently adopting birth dose. So planning and rollout is still underway, but would still fit into this category where the government has adopted the policy moving forward. It's important to note that we understand that this is a very evolving space and countries may have made decisions that we're not aware of. So if you are aware of your country adopting birth dose recently and you're not listed here, we invite you just to share that documentation, that policy document from the government with us, and we're happy to include you in category A. There are only 3 countries that are excluded that have adopted birth dose but have already achieved that high coverage, so would not be eligible for this type of funding. And those include Algeria, Cabo Verde, and Namibia. So category B is for countries that have not yet adopted birth dose. And the focus here is really on advocating for birth dose policy development, on increasing awareness and understanding of health benefits among policymakers, among healthcare workers, among community, trying to build broad support and a major focus on political will. Looking at the proposal requirements, the next few slides walk through the key. And we have developed a template that's available online where you can see all these areas in one document that you can fill in as you go if that's helpful to you. So the first requirement is just to provide some background on relevant information on birth dose as you understand in your country, and also the situation of prevention of mother-to-child transmission, access to hepatitis B services overall as relevant. Requirement is providing a description of your previous campaign experience, particularly related to developing campaigns for hepatitis vaccination, for other infant vaccinations, and also maternal child health. The third objective is really explaining what you want to achieve by developing this campaign and outlining your goals. And then fourth is then going into detail of what you plan to do in terms of your scope of activities and who you hope to reach. It's really important to note that this section 4 should be tailored to whether you're in that category A of advocating for improving coverage of hepatitis B birth dose because your country has already adopted it, or if you're in category B where the focus is on really that adoption of birth dose. And we've tried to spell that out in the PDF available online. So for category A, the target populations, so these are countries that have again already adopted birth dose but have not achieved high coverage. The target populations would be officials, healthcare providers, community health workers, community leaders, and also the general public, including pregnant persons and their families. And really trying to focus on improving implementation of the birth dose and its availability. In terms of activities that would be expected, the development of different types of infographics, reporting, posters, communication materials, identification of key messages that would resonate with these populations, really laying out a coordinated campaign of using these different assets and resources to reach these populations, leveraging available platforms such as mass media, radio, TV, public events, trainings, really thinking through how to engage key stakeholders in providing feedback, most importantly, the government, local government, and in terms of endorsing these materials, supporting the campaign, how you're going to execute and operationalize the campaign, and how you plan to evaluate it. For category B, so countries that have not yet adopted birth dose, we have a major focus on reaching political leaders and policymakers, the individuals who would be responsible for adopting a hepatitis B birth dose policy. This could vary in countries, but perhaps parliamentarians, senior health officials, senior Ministry of Health officials, other key academic leaders. We would hope to hear from you who you think those key folks are. In addition, though, we understand that you can build a political will through also reaching healthcare providers, community leaders, and also creating demand from the general public as well. So those populations are also included. And the scope of activities would be similar to category A in terms of the development of resources and designing a coordinated campaign of how you will leverage different types of platforms to reach these audiences, how you will execute it and operationalize it, how you will evaluate it. But the one addition is there would be an expectation for including a meeting with the government and policymakers. So after the scope of activities, we would also be looking for a timeline of when you plan to implement these activities, how you hope to collaborate with stakeholders, the impact that you have, And then again, an evaluation plan of how you hope to capture how effective your campaign was. So in terms of the budget, we would hope to see an itemized budget that corresponds to one of these three funding categories. We will have grants available up to $7,500, a medium category of up to $13,000, and the highest categories up to $20,000. We hope to fund about 2 organizations in each of these categories. So we do want to say that it's possible that we'll come back to you after you submit your application, and depending on the other applications received, ask you to revise your budget to fit where we have funding available in a different category. And then these are other additional proposal requirements. There. I have one additional slide I'd like to show, but maybe I'll stop. And John, if you want to add anything in terms of guidance, I'm just going to pull up the timeline.
Go ahead and pull up the timeline. I think that was a great overview. I just proceed with the timeline, then just want to begin to hear of any questions. I think it might be best if you could just use the raised hand feature in Zoom, and then we can begin to call on you for your questions, and we can provide additional information. Thank you. Sure. So just in terms of the timeline here, we opened proposals in September. We're having the webinar today. A reminder, they're due on November 2nd, and then we hope to make decisions in December. We hope to move quite quickly. Our funding for this project continues through next summer, and so kick off in January and have the projects completed over about 6 months, with closeout in July of next year. And then just in terms of how to submit, you will be email globalhep.org. Go back there. By Thursday, November 2nd at 12 p.m. Eastern Time, New York or Atlanta time. And you're welcome to use the template that we've provided or adapt it as would be helpful for you. Eastern Standard. So I just want to end here then by summarizing some key information. There are 2 types of projects accepted. Category A, focused on improving birth dose coverage in countries that have birth dose already. Category B, focused on introducing birth dose and creating a policy. Please make sure you specify which category you're applying to and tailor your activities accordingly. Please be aware there are these 3 categories of funding, the $7,500, the $13,000, and the $20,000. Please submit a budget to one of these categories, and then please remember the deadline for submission. Thank you, Lindsay. Just go back to the full screen. And let's see, we can begin to call on some people for some questions. I had some hands up here a moment ago, but I see none at the moment. Oh, there we are. Induka Ozor, please.
All right, thank you so much for the beautiful presentation. Before that, I have gone through the RFP and exactly what you presented. Thank you so much for the opportunities. My name is Mr. Nduka Ozor. I'm from Nigeria. We have actually started so much activities on viral hepatitis, especially in the northeastern part of Nigeria, where the incidence of Boko Haram insurgency affected a lot of health system, a lot of children and vulnerable people there. But my question on this particular RFP is this. Yes, we create awareness about the bad dose vaccinations, which is very, very low. The uptake is still very, very low, especially in some of the regions in Nigeria that I mentioned. Now, if we create awareness and people begin to demand, what is the next step? Because what we're going to do is to increase demand creation. through advocacy, through awareness, through social media, newspapers, radio jingles. If we succeed in creating awareness, what will be the next step? Because that's some of the problems we have in Africa or in Nigeria. By the time you create demand and people go to facilities, especially if we integrate it into ANC, and people go to facilities, what is the next? Some of our state governments do not have budget lines for some of these activities on their own. Thank you very much, sir.
Well, thank you for that. And for that sort of brief view, brief snapshot, if you will, of the circumstances in your particular area, and just some of the other issues that are relevant to the availability and the impact of a health promotion campaign. And I think that's something, that I think you can look at the various communication options to see what kind of messages to come out. And it requires a longer conversation than we have an opportunity to do, on this call. But I think, one approach to this is by increasing the demand and increasing the demand of the public. And when people go to their clinicians and say, where is the birth dose? It will motivate, the hepatitis B birth dose vaccine, the single antigen vaccine, is not some rare vaccine. It's widely available, in Africa, and it's just a matter of getting it prioritized to be purchased and available. So it does require that to really complete your ultimate aim of vaccination. But perhaps one approach would be to increasing the demand and the awareness so that the prioritization of purchase and availability of hepatitis B birth dose vaccine rises within that health system. So that would be an example of a communication objective, for your particular area through your health promotion. John Bafo, please.
Yeah, thank you very much and good afternoon. I'm John, the Executive Director for Reaching the Unreached International NGO in Ghana, based in Bono East and Oti region. It's a very good move. In fact, I went to a village, a remote area, about 700, 800 inhabitants, and in fact, hepatitis B has been a headache. A family, more than half of a family is wiped out because of hepatitis B. In a quarter, about 2 people died from that village. And there are culturally related things that are ongoing there, which I've taken upon myself and my organization to educate them. With the help of my brother, we tried to vaccinate. We vaccinated some people, and the education is ongoing, but then the demand is high for the vaccine, which we can't afford. In fact, hepatitis B is it's emergency, as we all say it. And even when people go in labor, those who are positive, how to get a vaccine for their children is a problem because they can't afford it. They can't afford it. It will marvel you that someone who will die of this case, when the person gets to the severe part where the person have a bloated stomach, it is believed that that person, if you're going to bury the person, you don't pass the body through the door. You have to pass the body through the window before you can go and bury the person. A whole lot of attribution. And we need a help to get a vaccines to these rural people. And we are seeking the support of other people, other organizations to help us to reach these rural people at the base. This initiative that you are making, I believe it will go a long way to help. I've submitted a proposal, and we are hoping that it goes through, and these rural people too will have a hope. Thank you very much. Thank you.
Thank you, John, for that comment. We look forward to reviewing your submission. I think you touched on the importance of hepatitis B vaccination, and so that the future generation does not have that burden of disease and early mortality that you refer to, and how can this type of a campaign be part of a national effort within Ghana to lower these financial barriers to vaccine. It also comes to mind to me, frankly, that you as civil society organizations, as you began to get more active in hepatitis B birth dose promotion, I think you will be in a good position to assist countries' applications to Gavi for financial support of hepatitis B birth dose vaccination. I can see that as a secondary benefit of having strong civil society organizations presence in health promotion for hepatitis B. And I think the other person, I'm trying to call on these in the orders that they popped up. So I think the next one was Mahmoud Hamid, please.
Hello. Can you hear me?
Mahmoud's
Hello?
next, and then Precious after Mahmoud, please.
Okay, good afternoon. My name is Mahmoud Hamid from Adamawa State here in Nigeria, the northeast parts of Nigeria. I also want to comment for this wonderful webinar, and as one of our colleagues said here about the issue of provision of after telling or after sensitization have done. The issue or the challenge that we are facing is to people how to access this vaccine should be the problem, because people or our communities, they are accepting the sensitization. If you go for sensitization and awareness, people are accepting it. But to go and access the services should be the problem, because there is an issue where people, they are not what do you call it, afford to buy or to access this the vaccine. This reminds me, because currently we are working on the Global Fund malaria program. We will go to community, tell the people, go to your facility, we have free malaria drugs. If you go to facility, they will tell you, no, nobody provides any free commodity. So that's our challenge. So thank you for this webinar, and we are hoping to develop our proposals, and we are hoping you people will help us in order to eliminate hepatitis B in our various communities. Thank you, sir.
Thank you, Mahmoud. Thank you for your remarks. Precious Piri, please.
Yes, hello everyone. I am Precious Piri from Youth Initiative for Change and Development, Malawi, a youth-led and youth-serving organization. So what I'm interested in, I don't know if you're able to hear me. There was somebody coming in. Are you able to get me?
Yes, very clearly.
Yes, so I'm saying I'm Precious Piri from Youth Initiative for Change and Development, a youth-led and youth-serving non-government organization operating in Malawi. So what we're doing so much is to do with sexual reproductive health, targeting adolescent girls and young women. Now, in your presentation, with regard to those organizations who need to apply, you say those people who have had the experience in the vaccination, maternal and child health. In this case, are we still eligible? Because I know we are generally into sexual reproductive health, which encompasses family planning, maternal health, but we have not had this experience of doing the vaccination. So would you please come out clear, because we know to say we are capable of doing what you are pitching.
Sure. Thank you, Precious,
And
for
then
that.
secondly, finally, before you come in, is to say maybe if you can amplify clearly with regard to the budgeting, what are the allowables, what are not allowables? Are there any percentage, or is there any ceiling, or it's just like as open-ended? Maybe you come out clear on that one.
Absolutely. Thank you for those important questions. In terms of eligibility for an organization like yours that's worked in other health areas, as I understand, sexual and reproductive health primarily, you're still eligible to apply. Note, we will be looking for experience in vaccination campaigns and improving awareness. So please just spend some time showing you can demonstrate you have that capability of developing that type of campaign and draw on the experiences you think are most relevant in your work. But if you feel like you have the networks and the experience and the know-how of how to implement a hepatitis B birth dose campaign that would be effective in your country, we certainly welcome you to apply. In terms of your second question on the budget, this also came up in the chat. We don't have very rigid guidance in terms of percentages in different categories. We would expect that there is funding for our staffing, for meeting costs perhaps, for development of resources, printing, graphic design. So that's really what we're looking for, but if you have specific questions on a specific type of cost you're not sure about, you're welcome to share that with us. During the proposal process, we'll be reviewing the budgets in depth, and if anything is a concern at that stage, we're happy to come back to you then as well. But we want these proposals to be creative, and so we don't want to be too prescriptive in terms of what the request is for.
Thank you. Gilbert, Miki or Mikey, please.
Hi, thanks so much for the amazing presentation. This is Gilbert Miki, the promoter of Community Vision Group, with headquarters in the UK, implementing HepB programs in Cameroon and Malawi. My first question is related to the presentation that highlighted the different categories. Category B, which highlighted some countries. Cameroon put in place the expanded immunization program in 2005, but the uptake in terms of vaccination, but dose has been really low based on our experience working on the ground in Cameroon. So just to highlight, I know you already indicated that we need to provide some documentary evidence that this Cameroon, for instance, has been able to put that up. But my next question will be, we operate in two countries, Cameroon, Malawi, headquartered in the UK. Do we put our application using individual incorporation certificates from the two countries, or we can apply as UK implementing programs in Malawi and Cameroon?
Given the size of these awards, it will be best to be applying from the local collaborators with your organization in the UK. It's just it seemed like that would help sure that the greatest amount of dollars are available locally, and given the size of these awards. So that's what I advise you to do.
Thank you so much. We'll definitely put in individually Cameroon and Malawi.
Thank you. I think we those categories are not they're to give some general guidance and some and some recognizing that there are some communication objectives that are different considering where a country is. I mean, you raise a good situation in Cameroon where they've had the policy, it just hasn't been implemented. And I would just encourage you to have a communication plan that reflects that reality. And you could still apply within that category, but recognizing just your communication objectives because of that low uptake and what needs to be done to change it in January. And then,
Lovely.
thank you very much. I have one remaining hand up. I'm gonna have trouble with his name. Odo Giogu, perhaps? And pardon me for a mispronunciation there.
Hi, good afternoon, everyone. Otojo Darlington, you are correct. Thank you. Okay, I'm Darlington, as you can see over there, Executive Director for International. Hello, can you hear me?
Yes, go ahead, please.
Oh, Executive Director for Institute of Health Advocacy in Africa. Yes, so I like what you guys are doing to combat this hepatitis at birth. I'm in Nigeria, and yes, most people here are prone to these cases, especially at birth. But the issues we have here is that the primary health center here, like that's the one that is more accessible for women during antenatal, because it's during the antenatal you can get vaccinated. Most times they are unable to get these medications free. You are battling with the price to pay for antenatal, and at the same time, you can't access the vaccines free of charge. So I would really like if there is a way or positions or policies to put in place to ensure that these things, when they are given out, they get to the masses as it should be. The demand is there already. So it's just the implementation that is the problem. Then secondly, aside at birth, the masses, adults or adolescents are also in high demand of the hepatitis vaccination, especially the high-risk men, the KP, key populations. So I would really love to, if this program can also be extended to adults, especially the key populations. It will be an honor because it's so much in demand. Because when you don't vaccinate the adults, they are still the parents of these children. The transmission will still be there. But when you are doing both child birth at birth vaccination and also doing for the adults, you are preventing it from continuing. So I would really like a consideration to be done for that. Thank you very much.
And thank you very much for that last question. The money we received from US CDC was expressly for improving vaccination of newborns, and so that's what the program objectives will have to be, and for good reasons, as hopefully everybody saw in my earlier presentation, the importance of vaccination of children, and so they don't develop chronic hepatitis B. Obviously there's some benefits of vaccinating adults. It will just have to be done through another program. I have to say, just in my experience and knowledge about vaccinations, adult vaccination programs in Africa, the ones I'm aware of, have started with a strong infant immunization program that included hepatitis B. So, perhaps strengthening the infrastructure for hepatitis B birth dose will provide, a program foundation to expand vaccinations to healthcare workers, for example, as a start, et cetera. So I think down the road could be helping you achieve that aim. Again, you recognize some of the other, challenges over and above awareness, such as was brought up previously, the financial demands for vaccination costs, et cetera. And, again, you just have to see what kind of communication, what kind of stakeholders needs to be reached by your communication program to help overcome, some of those barriers through increased awareness and knowledge of the benefits of hepatitis B vaccination for newborns.
Thank you. There's one question in the chat, John, a clinical question. Do we still offer HBIG to babies born to mothers who are surface antigen positive?
Yes, if you, hepatitis B immune globulin has been used to protect newborns from transmission since the mid-1980s, and it's still recommended to be, if available, to be used. And so if it is available in your country and it's from a quality supplier, so you can assure of its safety and if it's quality, then it's a recommended additional strategy together with hepatitis B birth dose to improve protection of mother-to-child transmission. For many countries, the cost of hepatitis B immune globulin make it a difficult intervention to use widely throughout their country. And that increases the importance of a timely birth dose, because the quicker that you deliver the vaccine to the newborn, the better the protection is. And then why there's been a greater attention on antiviral prophylaxis to lower that viral load and reduce vaccine failures through that approach, particularly when immune globulin is not available.
Thank you. Any other questions? Please raise your hand or put them in the chat. We have a few more minutes.
I want to thank you all for your interest in this intervention and for this program opportunity. I look forward to receiving your applications. You can ask us for additional questions. You can send those to us through our website, as Lindsay already mentioned.
One more hand.
And then I'll get back to that last hand here in just a minute when we just finish up to say, if we get questions that we feel like we have not covered or that is not well described in the application, we will post them on our site in an FAQ format. Dr. Lutakome Jamada, please.
Good evening, Dr. John Watt. I'm once again humbled and privileged. Why I raised my hand just after the questions and answer question session is because this is not a question, it's just a compliment. I'm really glad that you people always come up with such ideas and such fundings to help us eliminate hepatitis, and we are very humbled and grateful to be partners and to work with you people, and we are grateful. And I was of a request that this information that we have been posting on YouTube channels, we are going to do a social media campaign of of course sharing more, so that they start trending and we start to be seen. And this information is very great. This was great work that was done, and I urge everyone who is on this call that we should really follow these materials and, of course, share them. And it is already a way of creating awareness, and it will be very helpful. Otherwise, I'm very grateful and thankful. Happy to see you once again. Happy to talk to you. Happy to interact with you, and always happy to work with you. Thank you very much.
Thank you very much, and we look forward to working with you. Anything else in the chat?
No other questions right now. So thank you all for joining. We'll be posting this recording to YouTube and the RFP page, so you can refer to it. And we'll also, as John said, post any additional information that comes forward before the deadline next month. So thank you all for your interest. We look forward to reviewing your applications.
Thank you again.